I wanted to welcome you to the 2023 Living Well with the Blood Cancer virtual conference. This one-of-a-kind conference addresses the unique needs of a blood cancer community and offers the latest information, tools, and resources to help support Canadians affected by blood cancer. The Leukemia and Lymphoma Society of Canada is proud to introduce today's presentation, Managing the New Normal of a Chronic Blood Cancer Diagnosis. Our initial speaker, Julia Davis, is not able to attend today. However, never fear when the LLS is here. My colleagues, Desiree, Naylor and Natasha Sain, have graciously offered to stand in for her. Before we begin, let me introduce myself. I'm Leslie Ann Guiney, the Community Services Lead for the region in Ontario where your postal code would begin with L, M, or K. I will be the moderator for our online event today. We invite you to type your questions and comments into the Q&A box of your Zoom webinar panel. Throughout the presentation, an LLSC staff member will monitor the questions and will read some of your questions aloud at the end of the presentation. Due to the large number of participants in limited time, we may not be able to answer all of the questions, so also note that the speaker cannot answer specific questions about a person's health, history, or status. If we do not get to your question during the live presentation, a community services lead in your region will follow up with you shortly to try and get you the answers that you are looking for. Today's presentation will be recorded so that you can watch it on our website at a later date. Also, because you registered for this webinar, you will receive a link to the recording from Zoom shortly. Next slide, please. Are you looking for specific programs or resources, but not sure where to find them? We are here to help you every step of the way during your cancer experience. You can connect with a community services lead like me in your area to receive personalized assistance in finding answers to your questions and to be connected with resources and programs in your area. Please reach out to us by calling our toll-free number 1-833-222-4884. Next slide, please. We invite you to visit our website. Our goal is to better serve the community and offer an improved experience. On our website, you will find tailored information, including sections of the website dedicated for those living with a chronic blood cancer. Please do visit our website at www.bloodcancers.ca. Next slide, please. On our website, you will also find a new series of short videos that address the challenges of living with a chronic blood cancer. They include topics such as understanding chronic blood cancer, cancer-related distress, and understanding the fear of cancer recurrence. Next slide, please. Did you know that the LLSC has an app where you can track your symptoms and side effects and much, much more? Download the free Health Manager app to help better manage your blood cancer diagnosis. It includes medication reminders, a meal planner, medication and side effects trackers, plus shared caregiver access. This app is available for Apple or Android devices, and you can download it free of charge wherever you like to find your apps. Next slide, please. So now it's time to introduce today's speakers, Desiree Naylor and Natasha Sain. Desiree has been with the Leukemia and Lymphoma Society of Canada for nearly 4 years, supporting the blood cancer community as a community services lead in Alberta. In her role, Desiree works to provide support to those who have been diagnosed with a blood cancer, as well as caregivers and their personal support networks, by connecting them with the LLSC services and programs, as well as local community supports and resources. Natasha is the LLSC Community Services Lead for the BC Yukon region and a candidate for her Master's in Counseling Psychology. As a Community Services Lead, Natasha supports those facing a blood cancer diagnosis and helps them navigate the healthcare system and gain access to programs and resources for support and information. Outside of this role, Natasha has a passion for mental health and supports the LLSC Virtual Support Group program and mental health initiatives. Thank you for being here with me, Desiree and Natasha. Take it away.
Ooh, thank you so much, Leslie Ann. We are very grateful to be here today. Our presentation is structured into two parts. We'll start with an initial overview of chronic blood cancers and review some treatment types. as well as a brief discussion on treatment side effects. It is important to recognize that treatments such as active surveillance and the potential side effects like brain fog and cancer-related fatigue can significantly affect individuals who are living with a chronic blood cancer. We'll then follow this up with a discussion on how to navigate and adapt to a new normal while coping with a chronic blood cancer diagnosis. When we refer to a chronic cancer, we are describing cancers that do not completely go away or cannot be fully treated. These types of cancer may not progress rapidly, but can be effectively managed over an extended period of time, often spanning months or even years. In some cases, treatment may be required to delay the progression for as long as possible, and treatment may be also used to help manage symptoms. Certain type of blood cancers are or may become chronic and never completely go away, including leukemias like chronic myeloid leukemia and chronic lymphocytic leukemia, myeloproliferative neoplasms or MPNs, myeloma, myelodysplastic syndromes or MDS, and some types of non-Hodgkin lymphomas. When you have been diagnosed with a chronic cancer, the focus of treatment is typically on keeping your cancer under control or preventing it from spreading to other areas, not to cure the cancer. Being diagnosed with a blood cancer is overwhelming and it can change your life. You may be concerned if your doctor suggests you wait before starting treatment. For those blood cancers that are in the early stages or are slow-growing blood cancers such as CLL and certain subtypes of slow-growing or low-grade non-Hodgkin's lymphoma, doctors often adopt active surveillance as treatment. Active surveillance may also be called watch and wait or watchful waiting. For the purpose of today's presentation, we'll be using the term active surveillance. During active surveillance, your health and disease are monitored by your healthcare team through regular checkup visits and follow-up evaluation procedures such as lab and imaging tests. You may continue on active surveillance as long as you do not have any new or changing symptoms. There is no evidence that the blood cancer is growing or spreading, and there are no significant health problems. So it's very important to speak to your doctor if there are any new symptoms you are experiencing. Being on active surveillance does not mean there's no treatment available to you. Your healthcare team is monitoring you closely through regular checkups. They may decide that at this time, there's no benefit to starting treatment. Your healthcare team will make sure you get the treatment you need when you need it. There are advantages to active surveillance, and it should not be confused with inaction. While on active surveillance, you can continue your normal routine and maintain your quality of life. Delaying treatment can give you a longer period of time when you don't have to deal with the treatment side effects. It may help to reduce the risk of developing drug resistance and can increase access to new treatments if they become available. The experience of being on active surveillance can be quite overwhelming and daunting. You may be anxious and want to start treatment right away, so it can be hard to accept that delaying treatment is best for you. It's important to speak to your healthcare team to understand why this type of treatment is being recommended for you. Do not skip any medical appointments, regular checkup visits, or follow-up evaluation procedures such as blood work. Continue to look after yourself. Eat healthy foods, stay active, and rest. It's vital to care for your mental health during this time. Don't hesitate to access counseling and build your support network. Speak with your family to share how you are feeling. Join a blood cancer support group or connect with someone who might also be taking the active surveillance approach. The LLSC has a list of questions you can use to ask your healthcare team to learn more about your blood cancer. Asking these questions will help you understand more about active surveillance, help put your mind at ease, and help you take an active role in managing your care. Questions like, how often will I have checkups? Between checkups, what symptoms and other problems should I report? And what signs or symptoms will indicate that I need to start treatment? You may have questions that occur outside of your regular medical appointments. Keep a notebook and pen so you can write down your questions and concerns to take to your next appointment. Some cancers, such as myeloma, CML, and aggressive non-Hodgkin lymphomas, will also need to be closely monitored and treated, but they won't go away completely. They are then treated as a chronic disease like diabetes or heart disease. Your healthcare team will talk you through your treatment options and help you decide what is best for you. Discuss your treatment options with your doctor to make sure you understand the benefits and risks of each approach. Your treatment plan is based on your age and overall health status, the kind of blood cancer you have, your medical history, results from lab tests, your prognosis, or the likely outcome of the disease. With a chronic cancer treatment, there can be cognitive, physical, and psychosocial side effects. We'll take a moment to touch on brain fog and cancer-related fatigue, but the LLSC recently hosted a webcast on the F words, managing cancer-related fatigue and brain fog. For a more in-depth look at cancer-related fatigue and brain fog, as well as tips to managing both, I encourage you to check out that presentation, or reach out to your local community service lead for more information. It is often said that the most common and distressing symptom reported by cancer survivors is brain fog. Symptoms of brain fog include difficulty concentrating and understanding, agitation, confusion, and memory loss. The cause of cancer-related cognitive problems are still being studied, and its exact cause isn't always known. Although commonly referred to as chemobrain, it is unlikely that chemotherapy is the only cause of these problems. It's most likely multifaceted. Brain fog can have an impact in many ways, including causing frustration and being disruptive to functioning. Your healthcare provider chooses the treatments that they expect will treat your cancer. They know some of the treatments may affect your memory and your ability to concentrate. While there are currently no medical treatments for cancer-related brain fog, your healthcare team will work with you to reduce those side effects as much as they can while effectively treating your condition. Cancer-related fatigue is a persistent sense of tiredness, whether physically, mentally, and/or emotionally, that interferes with usual day-to-day functioning. It can occur at any time before, during, or after cancer treatment. All types of cancers and cancer treatments can cause fatigue because your body's immune system is working hard to fight the disease. You may experience fatigue if cancer treatment damages healthy cells, in addition to cancer cells. Your body will use energy as it works to repair cell damage caused by the treatment. These treatments change how cells work, can cause inflammation, and damage tissue and other cells. Blood and marrow cancer patients may experience fatigue as a first symptom to occur because their disease can cause anemia by preventing the bone marrow from producing blood cells effectively. Cancer-related fatigue isn't something that can be cured or fixed, but it can be managed. Increasing your physical activity, eating well, drinking water, limiting food high in sugar, resting, attempting to get sufficient sleep, and managing stress are just a few ways to help reduce cancer-related fatigue. There are many resources available to help manage side effects from treatment and your chronic blood cancer. Always consult with your doctor if your side effects are preventing you from living with a chronic cancer, or if you'd like further information on how to manage the side effects. Other resources you can access include your Cancer Center's Resource Center, organizations like the LLSC who have resources like our Health Manager app and side effect fact sheets. Try new physical activities that you enjoy doing, and look at ways of managing how you eat.
Thank you, Desiree, for that awesome introduction. We will now be transitioning over to discuss the emotional and mental effects of a blood cancer diagnosis. I'd like to start with this number, 40. This percentage represents the average number of people who are living with a cancer and are experiencing significant emotional distress, such as depression. I'd like you to sit with that number for a moment. It's a large number, and it shows that you are not alone. It is important to understand that people affected by cancer experience many emotions that can change from moment to moment. There's no right or wrong way to deal with a chronic cancer, and no right or wrong way to approach the disease and its impact on your life. Some days you may feel in control, but the next you may be in complete despair. You may experience different emotions throughout your cancer experience, including shock, anger, and denial. Next slide, please. Living with chronic cancer also means mourning your old life. Every step of the grieving process helps you to adapt and take an active role in your care. If you feel you can't do this, ask for help. For example, staying too long in denial may prevent you from making the best decision for your health or seeking the support you need from your family. In addition, you may have fears about pain and symptoms, about choosing the best treatment option, or about using alternative or complementary therapies. Next slide, please. Some of the emotional effects we discussed can manifest into mental health challenges we must navigate, such as depression and anxiety. Addressing our mental health is just as important as our physical health. And some of the benefits include coping with your diagnosis, pain management, treatment adherence, building strength and resilience, better decision-making, quality of life, and support and communication. Next slide, please. You may experience a range of emotions throughout your cancer experience, so it's important to familiarize yourself with the symptoms that may indicate mental health issues. Seek help if you suspect any of the following problems: suicidal thoughts, self-harm, substance abuse. This includes overuse of alcohol or drug addiction. If you're experiencing an eating disorder, and this includes eating too much, too little, or having no appetite. Next slide, please. You may experience a wider range of emotions throughout your cancer experience, so it's important to familiarize yourself with the symptoms that may indicate mental health issues. Seek help if you suspect any of the following problems. Anxiety. So some level of anxiety are normal, but when it starts to impede your ability to interact with family and friends, or it affects your daily living, then it's time to seek professional help. Depression. Feeling sad and worried is normal when you have cancer, but it is when these feelings are so strong and they don't go away for days or weeks, it's time to speak to your healthcare team for support. And PTSD, or post-traumatic stress disorder. This can occur at any time from diagnosis into survivorship. So it's important to seek help from a mental health professional who can offer you tools to manage your feelings and stressful episodes, easing the symptoms. I wanted to add that it's important that these symptoms are treated even if you are receiving cancer treatment. Next slide, please. So what can we do? Consult your doctor if your symptoms or mood don't improve over time. Step 1. Having self-compassion. Remember, to be kind to yourself, it takes time to adjust. Social support. Don't isolate yourself. Keep your circle wide. Remember that your illness doesn't define you. It's something that happened to you. Engaging in activities. Do things that you love, whether it's crafts, cooking. Make sure you engage in things you enjoy. Eat well and move to your ability every day. And keep a journal. This one's one of my favorites, and I'll speak to it a few times throughout the presentation. Journaling provides an emotional outlet. It helps us be self-reflective, and it can help in reducing stress and anxiety as well. Next slide, please. So next, I'd like to touch on the topic of fear of recurrence. This is manifested in the overt fear or concern about the possibility of cancer returning or progressing. And many individuals experience this around testing time. As we discussed previously, there are some tools you can use to be self-reflective and understanding when this is significantly impacting you. So step one, again, for journaling, this is my favorite. So you can ask yourself a few questions as you keep a log of your thoughts. So one, when does the fear of recurrence become more intense for you? So think about specific times, events. For example, are you having these feelings at follow-up appointments? Are there significant milestones related to your cancer experience? Is it around when you're feeling new symptoms or health challenges, or even during stressful life events? Another important question to consider is, does it affect your daily functioning? So what that means is, are you persistently worrying? Are you ruminating or having difficulty concentrating on tasks? These are all important things to note. And lastly, does it cause you significant distress? So although distress can be subjective, it is considered to be significant when it impedes your ability to live a fulfilling life, maintain your relationships, engage in your treatment plan, or if you experience any kind of loss of motivation. At the bottom of the slide here, we have some predictive factors for fear of recurrence, and these include age. So those who are younger are more likely to experience fear of recurrence. Biological sex, so we see this more prevalent in females. History of psychological disorders, so particularly those with a more anxious temperament. Recent diagnosis or stem cell transplant. And lastly, those who experience a second cancer following a transplant. Next slide, please. So on this slide here, we have the cognitive cycle for fear recurrence, described as a vicious cycle, as we can get stuck in a loop with our negative automatic thoughts, sending us into a spiral. So here you can see a case example common to many. So the fear of relapse, that's the interpretation. We see the underlying emotions at play are anxiety and fear, and we turn to cognitive avoidance and reassurance seeking. So just on the right there. So what that means, so for cognitive avoidance, you may start avoiding reading or talking about your cancer. You may start avoiding appointments, and this is in an effort to provide temporary relief. So think what you can't see here is not happening. With reassurance, we see behaviors in seeking continual information or reassurance from others that what you are experiencing is not a reoccurrence. And then that sends us into a short loop. So as you can see, these behaviors then feed back into a decrease in anxiety in the short term, but not in the long term, and thus sending us back into that circular loop. Next slide, please. So the question is, how do we close this loop for long-term benefits? Well, first step is we must be realistic in our thinking, but how can we do this if we're stuck in a cycle? Well, we have to develop coping strategies and tools that allow us to interrupt these automatic negative thoughts and challenge ourselves to find these cognitive distortions. I'm going to use journaling again, as it's one of my favorite tools and something so versatile. You can actually use journaling during these cycles to help you identify the specific thoughts or beliefs you are having to help you track patterns and triggers. This can provide both you and your mental health professional great insight into supporting you develop tools to cope. These tools can include things like journaling, deep breathing, and helping you become grounded. Next slide, please. Seeking professional help with fear of recurrence is really important, as it can help support you with understanding the cycle, so understanding that vicious cycle of fear of recurrence. It allows you to ask yourself, does thinking influence cancer? When you are stuck in the cycle, it really doesn't. Managing your emotions with realistic optimism, learning to tolerate uncertainty, and this is done through building strength and resilience. Demystifying beliefs about the usefulness of your worries, facing up to your fears, and asking the tough question, what if a recurrence occurs? So I urge you to work through these with the support of a mental health professional. Next slide, please. So now we're going to move to working towards a new normal. So everyone experiences cancer in their own way, and the same applies to living with chronic cancer. I think this is so important to understand, as everyone's situation is unique and everyone's experience is unique. You are valid and the way you are feeling is okay. It's important to never compare yourself to others, as this is your experience. Your new normal will be shaped by the changes cancer brings. For some, normality will be returned to the life they led before cancer, while for others, life will never be the same. You may have new physical problems, new lifestyle habits, or new financial realities. Some people affected by cancer report changes in their relationships, personal strengths, a spiritual shift, and a greater appreciation for life and new possibilities. Cancer can also be negative, but it can also give you the motivation to seek new meaning in your life. Whatever your experience with cancer is, remember, you're not alone. Next slide, please. Supporting yourself. So if you're undergoing treatment, we urge you to take your medications as described. Make sure you're keeping up with, oh, you know what? I think I just, sorry, I'm just gonna make sure I'm in the, do your best to live in the moment rather than projecting yourself into an uncertain future. Ask yourself which of your relationships mean the most to you and focus your energy on and time on them. Let go of relationships that are a source of stress for you. Again, make time for the things you enjoy, especially activities you haven't done in a while. At this time, you have the right to have fun and enjoy life as much as you can. Next slide, please. So getting support. It's important to talk about your emotions with a therapist, friend, or family member. The LLSC has great programs like our virtual support group or peer support program. Joining a support group can make a great difference with community support. Move according to your ability and eat well. Nutrition and exercise are so important. Make sure you limit alcohol and avoid tobacco. And find out what symptoms to watch out for, and always consult your healthcare team if they appear. Next slide, please. The most important piece here is don't hesitate to seek help. There are resources that are available, and you can connect with your care team to get access to hospital programs. You can reach out to us, the LLSC Community Service Lead in your region, for personalized support for programs and resources. And you can connect with your family, friends, and loved ones who will be able to support you. Thank you. So now we will move on to the question and answer period.
Sorry, everybody, I wasn't able to turn my microphone back on. So thank you, Desiree and Natasha, for sharing your expertise. That was a great presentation. And thank you again for stepping in so quickly when we were not able to have Julia speak for us today. It's now time for our questions and answer period. And if you haven't already done so, please put your questions in the Q&A box of your Zoom webinar panel, or type your question into the chat. As we mentioned earlier, due to the large number of participants and limited time, we may not get to all of the questions. And if we don't get to your question, your community services lead will connect with you shortly after the presentation to answer your question. So I have a couple of questions that were sent in to us on registration forms that I'm just going to ask Natasha and Desiree. The first question is, I am interested in approaches to dealing with the unknown of being able to fully care for myself as well as my cancer progresses. What are you thinking we could say about that?
I think the most important thing there is to start the conversation with your medical team, asking questions about what to expect before, during, and after treatment, so you can help, or so you can start planning for your future needs. If you live alone, that's something that you want to share with your healthcare providers. You might want to ask for a referral to a social worker. The social workers in the hospital are excellent in helping you find local resources, support programs. I know we get a lot of social workers referring to our programs, like our support groups as well. In addition, coming up with a list of challenges you're facing, for your discussion. So if you're struggling with anything like meal preparation or nutrition, you know, you can chat with them about that. The LLSC also has the Health Manager app, which has lots of nutrition advice and recipes. Also speaking with your friends and family about areas of support that could be helpful. You know, everyone can, do you need support with appointments, for example? Are there people who can help you with that? Often friends and families can help set things up to help you navigate and relieve some of those practical stresses that you might be facing.
Thanks, Natasha. The next question, or Desiree, did you have anything to add?
Oh, I was just going to say, and ask for help and delegate. You know, people want to help you. They just might not know how to help you. So if you are living alone or you have a care partner in another area, like ask them to set up, say, like a group chat that you can delegate tasks to them to see if they could also ask other people to help with. But just at the end of the day, ask for the help that you need.
That's really great advice. I just wanted to share a quick comment that came into the Q&A box. I wish I heard this the first time I got my diagnosis with CLL 20 years ago. I am happy now with the new information, but I'm really impressed with your presentation. So just so that you know, everybody really loves what you're talking about here. How can you address someone who is living with MDS who is masking their symptoms from their HCP? What would you say to them?
So say that again.
So the person is asking, how would you address somebody who lives with MDS who is actually not telling their HCP about their symptoms?
Ooh. I think that how somebody processes the cancer diagnosis is just very unique to them. Everyone's going to react in their own way. Sometimes denial is the mind's way of coping with the painful facts such as that cancer diagnosis, and no one really chooses to be in denial, but in some ways a short period of time can be helpful because it can give you time to feel less overwhelmed by the news. Sometimes that denial can fade with time, but it can be a problem if it does last more than several weeks or months. You know, those follow-up appointments with the healthcare team can really help to better understand the diagnosis and give it time for the information to settle in. I would say the biggest way is to support with patience and time.
Perfect.
Yeah.
And Natasha?
Yeah, I think Desiree really hit the nail on the head there with denial. Denial is a big coping mechanism. So even getting mental health support for that and working through some of those fears, denials that your loved one is experiencing can help them kind of navigate through that as well.
So the next couple questions are really sort of about how to change lifestyle. And the first one is, having led a very active life and now being sidelined by this disease is very difficult. How can I get the most out of each day when I really don't have the energy?
I think it's normal to find time after treatment or a period where there's that transition and adjustment, and sometimes it can be more challenging than expected. You know, you're experiencing things like fatigue that wasn't there before. I think the best way is to have a bit of self-compassion and patience and know that you will get back there. And the best way to get back to that active lifestyle is being having good nutrition. Nutrition is a key part of your recovery. Maintaining a healthy body weight and slowly working up to where you were before. So if you're able to go out for a small walk, put that into your time. Focus. I guess the key thing is focusing the time when you do have energy on activities that you enjoy. So whether it's getting outside to be active or like going for, I guess, a light walk, starting to go on short runs, doing it very slowly, and always engaging your healthcare team. So if there is an activity that was quite strenuous before, talking about like a return to work or return to activity, what you can do to help get back to where you were. Yeah.
Some great information. Desiree, did you have anything to add?
Just, talk to your social worker, talk with the oncologist, and just look at those activities that are safe for, going back into activity. There are some great, like yoga would be fantastic to start with. You're not going to be starting off running, but also just know that, we kind of touched on it a little bit, but it is normal to have that fatigue. Could be a part of the treatment, could be part of, your body is just healing. So just understand that you're not alone, and there are other people that are also experiencing this sort of fatigue.
Perfect answer. So this question is a little in depth, but I think what they're really asking is, what can you do to nudge somebody when you're asking for help and they're not really giving you what you need? How do you tell the person what it is that you need without hurting them because they think they're helping, but in their own way?
Oh, I like this question. So communication, effective communication is so important. And sometimes when we're in high stress moments and, of course, with chronic cancer and all the challenges you have, it brings so much stress for you, and, caregivers experience that stress as well, that it affects our ability to communicate. And there's a tool you can use to help you both have better communication. It's called you and I statements. And you basically, there's a formula to it. So you can say, it's, I'm trying to think of an example now. Like, I feel that when you don't come with me to my appointment or something, it makes me feel more exhausted or something. I'll think of a better example maybe after the next question, but it's called a you and I statement, and it's a formula where you kind of fill in the blanks, and it helps for having better, more difficult conversations without hurting anyone's feelings, because you're not using shoulds as the most important. So if we go to the next one, I'll find a better example quick.
Perfect. So Desiree, did you have anything to add to that?
I would just say, yeah, open communication, start the conversation, and just, kind of share ways that they can help you, or help kind of with it. If you want help with, say, dusting, or you need help with doing kind of more of that physical chores, ask for the help with that. And then as the caregiver, obviously, just don't take it personally. You both are going through a lot. No one asked for the cancer diagnosis, but as the caregiver, no one, asked to be the caregiver of the situation or the care partner. But also look for caregiver resources and find out how, what kind of things you can do to be a care partner in this experience.
So I have another question along the same lines, but it is sort of from the other side. So as a partner to someone who is living with a chronic blood cancer, how can I change and make my life easier to support them the best way that they need to be supported?
Ooh.
Can you repeat that question? Sorry. What?
Yeah. So as a partner of someone living with a blood cancer, what changes can I or should I make to my life to support them the best way that I can, and they need to be supported?
Okay. Yeah, I think that,
go
I
ahead.
was just gonna say, I think that runs on the same lines of communication, as having clear and open communication, and sometimes just asking the person, like, how can I support you? What can I do? If you're feeling like you're unsure, I think sometimes that's the best thing, is being honest from the start, and setting expectations and boundaries early on to make things easier, and trying not to assume what the other person needs. I think it's just about being able to ask your partner what they need, I guess. Sorry, did you have anything to add?
No, that was great.
Perfect. So the next question is a little bit long, so I'll read it as it is, and then we can try and go back and figure out what we're actually going to answer. So my cancer was misdiagnosed as a curable non-Hodgkin's lymphoma, but after I completed treatment, I was told I have a rare form of follicular non-Hodgkin's lymphoma that is very aggressive. I have treatment right now every 3 months. My question is in regard to actively monitoring. I have been told there is no scan or imaging. I need to just watch for symptoms of this aggressive form of cancer, and it's making me very anxious. How can I watch for the symptoms and know that they are symptoms, and not something else? And how can I help myself to feel less anxious in the situation?
Ooh, I just to start off, I guess, like having that conversation with your healthcare team of what are the symptoms and like ask for that information, know what to look for and what is part of your diagnosis. So maintaining that open communication with your healthcare team is probably one of the biggest things. And then we did give a couple of great suggestions in here of, it is anxious being on that active surveillance, look at counseling. Make sure when you're talking with a counselor, though, it's somebody that has experience with a chronic cancer, or has worked with other chronic cancer patients previously. Natasha, anything else to add?
Yeah, I would say the LLC Health Manager app is also really good in tracking for symptoms tracking. It's an easy way to plug things in and then go back to your healthcare provider. But just echoing what Desiree said, I think also talking to your healthcare team if you are feeling very anxious and on edge all the time, because they can also provide you supports like counseling or otherwise supports to help manage and cope with the active surveillance.
Thank you both. I have one last question, and I'm sure we have a few tips on this, but how do I know when it's time for me to go back to work? How do I know mentally that I'm really good to go back to work?
I think the biggest thing is understanding your abilities, what your work demands of you, and working with your healthcare team. And they're going to be the best one to kind of guide you on a transition to work. Most workplaces have or will accommodate kind of a transition or return to work plan. I think there's some online resources as well that give you steps to returning to work after cancer. But I think the main thing is understanding where your strengths lie, where your struggles lie, what demands of your job are, and a discussion with your healthcare team to determine what the right, progression is to go back.
And Desiree, did you have anything to add?
I think too, like reach out to, the LSC. There are some resources that we can connect you with. Some other organizations like Cancer and Work that talk about, the 10 steps of returning to work. A good return to work plan also really involves that monitoring, like Natasha said, of the progress, and addressing concerns. And so just, again, having the open communication with your healthcare team, but also, it's okay to know that you might not be 100% recovered to start a return to work plan. And it may take some time to recover fully.
Well, that was great information. My friends, Desiree and Natasha, thank you again for your time. That was the last question that we had. So if we could just move to the next slide. This has been a really valuable information, and I've really enjoyed presenting this with you. Before we sign off today, I want to remind everybody of our upcoming conferences. There is one this afternoon called Infection Prevention, Staying Healthy During Cancer Treatment. Tomorrow, we have a Blood Cancer and Spirituality, which I am really looking forward to. And in December, the new treatment guidelines for chronic lymphocytic leukemia. Next slide. We would also like to thank AbbVie, AstraZeneca, BeiGene, Bristol Myers Squibb, GSK, Janssen Pharmaceutical Companies of Johnson & Johnson, Jazz Pharmaceuticals, and Kite, a Gilead company for their support in making this conference possible. Next slide, please. Please remember that we are here to help you every step of the way. You can reach us by email, by visiting the website bloodcancers.ca, or by calling us toll-free at 1-888-222 4884. Thanks for being with us today and have a great afternoon. Please take care.
Thank you.